recently, or not recently, but there's a lot of demand on natural treatments, on regenerative treatments, and this is where we come into the whole world of PRP, which is obviously platelet-rich plasma derived from the patient's own cells, from the thrombocytes. We just a little explanation to the PRP. PRP means I do take a blood. I do a blood flow from patient, I centrifuge in a certain protocol, following a certain protocol, to increase platelet numbers. Why platelets? Because basically the platelets are the ones injected to, in this case, the scalp, will activate the release of growth factors. Growth factors beneficiary for hair growth. SVF, or fat, what does that have to do with hair growth? Just an explanation. Fat, we go for nano fat, so we take the fat after tumescent local anesthesia, we take the abdominal fat, we centrifuge it and prepare it in a certain way according to the different protocols of the different kit suppliers, and we go for either the fat injection to the scalp or fat and SVF, which is stromal vascular fraction. That's a subfraction of the nanofat, microfat. It is a subfraction generated by centrifugation and providing increased numbers of stem cells able to stimulate the hair follicle. So what is the concept behind? The targeted organ is the hair follicle, and we understand that the stem cells lying in the bulge of and the dermal papilla and the dermal sheath of the hair follicle are stimulatable. So you can the target, or what we need to do is to shift the hair from the telogen, the falling off phase, back to the anagen phase. And we know by mice models, we know by human studies on humans, that the hair follicle, the stem cells of the hair follicle, are we can stimulate this organ in order to, again, shift hair back to the growth phase. And we know that by doing so, we can increase hair density, hair thickness, and reduce the telogen phase. Okay, so it's a very complicated way of mode of action. There are a lot of studies going on. The difficult thing is that we don't know, we don't have a consensus yet on to define which a protocol to go for in order to get best results. It is since years now a process of and undergoing. We have a lot of data showing that we can do great results, but I think we're not there to say to the doctors, okay, use this kit, do it this often, do it in this centrifugation mode, do it with this filter. Difficult still. But from my personal experience, I can only say that all patients I did do respond really nicely. The point I want to make here is these treatments are very interesting. Again, they have this downside that we still don't really know what is the best way to go. But never forget, we are doctors, we have to flank those treatments with our other treatment modes. So I never have any patient leaving my clinic without a prescription on topical, like minoxidil, finasteride, estrogen, might be even vitamins in like caffeine or melatonin. So an individualized prescription to be used at home. Second, might be tablets for the men. They can obviously we can prescribe the finasteride orally for them, and it might be other flanking therapies like controlling thyroid function, etc., etc. So again, it's a big picture I'm opening here, and it's a long-term treatment protocol. The most tricky part is, by the way, the result is nice, but what's happening on the long term, and we have to take care of the patients there very well. The indications for hair loss treatments are most of the time androgenetic alopecia and the diffuse alopecia. So speaking in practical terms, PRP, nanofat and SVF are injected into the scalp. So the protocol for injections in the scalp are different according to what I'm using. If I go for the regenerative mode, it's a one-in-a-while treatment. So typically we see results starting after 6 to 8 months, and it depends a bit on how aggressively the hair loss is, or how the individual pattern look like, but we don't have long-term data, but from the literature there's I don't know, might be in 5 years or so, another treatment. If you go for PRP only, what I don't prefer personally, it is a treatment every 4 weeks, 6 in a row, and one treatment every year to maintain the result.